All right, we're going to talk about ED medications.
Sure. Let's talk about it.
Cialis.
Oh, yeah.
If your thing has lost its zing, Cialis. If your wiener is sad. Okay. Cialis.
Dear God.
They should hire me. Okay.
A lot better than the bathtub commercial, so.
The bathtub?
Yeah, when they have, the Cialis bathtub commercial where you have this like couple sitting in a bathtub, like holding
people
hands.
don't do that.
No,
That's
they don't
stupid.
do that.
Okay, go ahead.
They have sex and they go to bed. All right.
Some people watch Netflix. Okay.
Okay, here we go. Stream Team, welcome back. Dr. Joe Pazona. We are here for part 3 of our exciting series on ED.
Is it exciting?
Well, yeah, we're talking about the penis.
Oh, we're always talking about that, though.
I mean,
it's not new.
No.
Okay.
I mean, again, it's our best buddy below the belt.
I'm sure it is.
I mean,
obviously.
I mean,
continue. This is our third episode about erectile dysfunction.
Yes. So now we get to talk about the drugs.
Ooh, yay, drugs. Okay.
Yeah. Not those kind, Catherine.
Okay.
This is not 1990s like New York clubbing.
Okay, I'm not going to comment on that any further, but we'll talk about erectile dysfunction medications.
Sounds good. Let's do it.
Balls deep.
What are they? Erectile dysfunction medications.
What?
You said we're going to talk about it. Give us some.
Well, I think you'd have to be living under a rock if you haven't heard of these pills before.
The blue
right?
pill.
The little blue pill.
The blue pill. Tell us all about the blue pill.
So first to start, did I ever tell you the story as to how they discovered Viagra or sildenafil?
Okay, actually, I think you did, but it was probably one of those times when you were talking and I was not listening.
You were spacing out.
Yes.
So, well, I'll tell it for
Give it
for
to
our
us one
audience.
more time.
So the generic name is sildenafil.
Okay.
And it was initially being studied for this condition called pulmonary hypertension. Basically, when the blood vessels around the lungs are too high of a pressure and it can cause bad stuff. I don't remember. It was from medical school years ago.
Wow.
But pulmonary hypertension.
Okay.
And so when these guys who were on the pill were coming back in the office, they're like, well, do you feel any better? Are you breathing any easier? Is your chest hurt? He's like, nah, not really. But can I get about 100 more of those pills? And like, what are you talking about? You just told me, I need more of the pills. So these guys were coming back stating how their erections were like way better.
Okay.
And so then the drug company goes, let's forget this like pulmonary hypertension thing and ED. Look at the new ED drug. So that's how Viagra or sildenafil was born in the 90s.
It was an accident.
It was an accident.
Okay.
Absolutely. So we've heard of Viagra or sildenafil. The other most common one is Cialis or tadalafil. Okay. So those are the two most common ones. And then there's Levitra and Stendra and some other ones. Bottom line is these all fall under a class of drugs called PDE5 inhibitors, phosphodiesterase receptor 5 inhibitors. What does this mean? So at the nerve ending for most of our blood vessels let me rephrase that. There are nerves that go to all of our blood vessels, right? So when we get really excited, what causes, blood to rush to our face and blood to go away from our stomach and other areas? Well, it's because those blood vessels are constricting. What's doing that's our nervous system. And so just as when this thing goes, he's
pointing at his brain.
She's looking pretty good right now. We send a signal down there, and that nerve is going to go to those penile arteries like, all right, let's start getting to attention here. So when we have erectile dysfunction, one of the neurochemicals there gets broken down, and it gets broken down too quickly such that we can't get enough blood pumping through there. So what these medicines do is prevent the breakdown of this neurotransmitter or chemical to say, hey, blood vessels, stay open because she's looking fine. And that's how the medicine works.
Okay, that was getting really kind of technical, and I absolutely spaced out completely. Basically, I think what
that's
you
right.
were
I was
saying...
looking at you, and you're looking cute right now.
That
so
I am. Thank you.
We're talking about ED and whatever.
Thank you. But what I took away is there's a pill that you can take and then swing.
Yeah, I mean, you asked me how it works.
You gave all this technical stuff, and no one cares, frankly. No one cares about that. The pill causes... the business to work.
Ma'am, you asked me a question. I answered it.
I did. But how fast do these things work? Is it like you take the pill, you're at a restaurant, you need to leave? What? I don't know. I mean, inquiring minds.
So great question. We often get that from patients. Like, am I going to walk around with a boner all day? And the answer is no. So the way that the pills work is, again, first and foremost, you have to be interested. Okay. So if it's not like when we were teenagers and the wind blew the right way and it's like, oh, I just got called up to the chalkboard and I'm wearing sweatpants. This is awkward. It's not going to be like that. So you've got to be stimulated first and foremost. Now, here's the key difference between, I'll just use the name brands because that's what people are going to remember. Okay. So Viagra is a little bit more of the on-demand sort of pill. So in other words, this is all right, tonight looks like I'm getting lucky. Bought her a nice dinner. We're heading home. Kids are away. We're going to have some fun. You take it on demand because you've got about a 4 to 6 hour window for the medicine to work. Now, how quickly you absorb it and it works depends on how full your stomach is. So if you've done this right after dinner and you've had that ribeye steak, a glass of wine, and a bite of that chocolate cake because it's chocolate cake, it may be that erection's showing up at about 3 a.m. when you're both asleep. So we often find that this is really great for kind of morning frisky time. So you wake up in the morning, you pop your Viagra when your stomach is empty and your testosterone levels are sort of peaking, and hey, the magic happens. Now with Cialis, it's been labeled as like the 24-hour Viagra, right? So conceivably you could take a Cialis today and it should, quote, work for the next 24 hours. Again, all this is theoretical. And all of it really is trial and error and individualized. So I can't look at a guy and go, oh, you're going to need 20 milligrams of sildenafil, take an hour before whenever, and you're going to be good to go. He might need 40 milligrams. He might need the maximum dose of 100 milligrams. So it's a little bit of trial and error. I tend to like the Cialis a little bit better because you don't have to worry about that spontaneity. Conceivably, you could just take your Cialis every day, and if you have relatively mild ED, that should be a high enough dose for it to work for you. But the daily Cialis is probably not going to do it if you're more of a more moderate to severe ED, where, again, more foregone, you're a little bit older, you may need a higher dose, and those higher doses are probably going to be more on demand. So this is getting into the weeds a little bit, but this is why I do what I do, and this is the nuance of how you prescribe these medications.
Okay. Other than those two, which I think we've all heard of, because there's a lot of television commercials out there, what other medication can you offer for erectile dysfunction? Or are those two pills it? As far as medication?
Great question. So again, we want to clarify. So medication is all encompassing. There's different ways to take medicines. You could go through the skin, you could take a pill, you could take a shot. And so when it comes to the pills, yes, there's other pills, but for the purposes of this show where I've got no skin in the game or honestly care which one you take, and I think they all have their pluses and minuses, that's that big category. Now, the other big category of medicines are not as fun to take because it's a shot.
Ooh, okay.
So there's actually something called penile injections. So why would someone want to stick a needle in their penis?
Well, I can think of why, but...
Well,
yeah, I mean, I can think of why.
But why?
The reason, I can think of that.
Why wouldn't you just take the pill? And the reason is that in cases where the erectile dysfunction is severe enough, the pills don't work anymore. So again, if that blood vessel is so scarred, that tiny blood vessel going to the penis is so scarred you can't get enough blood in there, there's a maximum dose by which it's just not going to help anymore. Okay. And so now what we have to do is deliver a medicine right into the tissue of the penis.
You got to take a shot to the wang.
Shot to...
Sorry, is that inappropriate? I was trying to think of a better word.
A shot to the wang.
I'm going to get fired.
No, it's
but you
too
take
funny.
You take a direct shot straight to your business.
Yes. Now let's.
That's gotta hurt.
No, actually, I tell most guys.
Do you numb that?
No, and honestly, for most guys, hands down, the most common things guys say is it wasn't as bad as I thought it was going to be. So let's first
Okay.
talk like how it's done and like because I'm
What
sure
are
some
you
guys
injecting?
yeah. So some guys here are thinking like you get a needle this big
a
and
foot long.
the woman with a giant smile on her face is just stabbing it through the head of your penis.
We
and-
are. No.
No. All right. So first and foremost, what are the medications? They're called vasodilators. So similar to the Viagra and the Cialis, we're dilating blood vessels. Okay. So the most common one is something called triple mix, where we take 3 different medicines, combine them at small doses, and they all work slightly different. And we're trying to just open blood vessels. Okay. Number 2, it is a very, very small needle. So it's probably only about that long. I tell
tiny.
guys you can't hurt anything if you try. And it's so small, most guys, and also most guys who have that degree of ED, they do have some decreased nerve sensation. So when I give guys their first injection, they go, oh, that wasn't that bad. So what we're going to do is we're going to put that needle in. If we go back to the anatomy of the penis here, so kind of we got the cross section here. There's 2 erectile chambers at the top. Okay. And so what we want to do is put the needle in the side of the penis, anywhere along the shaft. So we do not want to go in the head. That would hurt. And we don't want to go on the top because that's where some of the major blood vessels and nerves are going to the penis. And the bottom is where the urethra is, or where a man urinates through. So it's a quick little injection into the side of the penis. When you get good at it, it takes probably 10 seconds at most to put the needle in, push in the medicine, and be done. And then it can start working within 10 to 15 minutes.
How effective is it for overall?
So overall, I'd say very effective. I can't give a number because, again, every guy has a different degree of erectile dysfunction. Some guys, it does nothing. Some guys, the smallest dose of the least potent version gives a guy an erection that's basically throbbing and is really uncomfortable. And so what I warn guys is that it's not the needle that hurts, it's the after effect in some cases. So if you get too much of a dose for your body, you can get one of those 4-hour erections that, trust me guys, it may sound good, like you're going to call up all your neighbors, friends, and everyone else. It is not fun, because basically what's happening is no fresh blood is cycling through the penis. So actually, if we go back to like normal anatomy here to geek out for a moment, during an erection, fresh blood is constantly going in and leaving those erectile chambers. So even if you have an erection for 20 minutes, it's fresh blood cycling through. Whereas when you have a medically induced erection, and it's, again, not natural physiology, the blood's gone in and it ain't coming out. And so the blood can start getting thick. The penis starts getting all the oxygen out of the blood, and now all of a sudden the oxygen levels drop, and now it starts hurting, because basically the penis has almost got like a tourniquet on it, for lack of a better way of thinking of it. So medicines can be very effective, but again, this is something you want to go see a board certified urologist. This is not the time to go to the local, quote, men's health clinic who claim to be men's health experts, but they're not overseen by a urologist at all, because those places, again, this is how they make their money, is on these shots. These medicines don't cost that much money. And some of these places charge guys like hundreds of dollars, which is just predatory. And they want to make sure it works. So they slug these guys with big old doses.
So it's too much.
And it's too
way
much.
too much.
And so guys have a bad experience and don't go back. Like, oh, look, it worked. I treat it like barbecue. I go low and slow. I tell guys, listen, I'm going to start a really low dose. And if it doesn't work, that's okay. I'd rather it works 50% the first time than 150% the first time. So as long as you're really careful with the dosing, that priapism, which is an emergency. So guys, if you ever have an erection lasting more than 4 hours or approaching it, go get help. You do not sit at home and just keep
Go
icing
to the
it.
emergency room.
Absolutely.
Okay.
Or call the urologist who was treating you.
Mm-hmm.
But yeah, this is the time where, again, go see someone, individualized approach to it. And in most cases, guys do pretty well with it.
Okay.
Yeah.
All right. So we've got the Cialis, the Viagra, this shot.
Yep.
What else? Anything else? Or is there Are we out of options?
Yeah, I mean, I think that, that we aren't out of options, but I think if we're going to really focus on today's show of just talking about the ED medicines,
The medications.
these are really the true medicines. Now, we've got vacuum pumps and surgeries we can do, but not really germane to today. It might be beneficial to kind of walk people through a little bit more about the pills, because there's a lot of sort of myths or concerns about them. So first off, side effects. So first off, the 4-hour erection with the pills is pretty damn rare.
Okay.
I only saw it once, and that was some guy when I was working in Chicago at Northwestern, came into the ER, and he was, he didn't need it. He was recreationally taking it and took way too much.
So it was his own, it was of his own doing.
Yes. So
Okay.
I certainly hear stories of these young kids in their 20s who are like, well, man, I need some Viagra.
No, you don't.
Well, why? Well, I need it for round 2. Bro, listen, if you're waiting to go round 2, just wait a little bit. It'll come back at some point, but I'm not giving you Viagra for round 2. Like, just not safe and smart. So first
Be
off,
grateful for round 1.
well, I mean, listen, to each their own. We're not talking about married couples in their
Okay,
40s. So, so first off, that 4-hour erection is rare. Number 2, these pills do not cause heart attacks and strokes. That is a very common concern that either the men or their partners have of, well, I don't want them on it, or my partner doesn't want me on it because they're worried I'm going to have a heart attack and die. So have people died on those pills? 100%. Did they die because of the medicine? They did not. So
And that's definitive.
right. And so what caused them to die? What caused them to die was the fact that for some of these guys, again, we think about all the risk factors for ED, diabetes, obesity, smoking, high blood pressure. It eventually leads to heart disease. You typically get there because you're not the most active guy. So what I tell people is, you imagine you wake up the old dog who's been sleeping for a couple years, and it's been a while, and you've taken this pill, and you're like, oh, yes, I am ready. And so now this guy goes and has sex, and he's so excited, and he's huffing and puffing because this is maybe the most exercise he's seen in 2 years, and it's the exercise that stresses his heart, and he dies.
And he's given himself a heart attack.
Yes. But it's not the pill.
I'm not laughing, but that's crazy.
It's not the pill that caused it. Now,
Right.
Now, could you argue, yes, the pill gave him the erection caused him to have sex caused his heart rate to go up, his heart rate going up stressed his heart, he had a bad heart, he had a heart attack and died. Yes, so the pill did kind of lead to it. But you're not going to just give a guy who's otherwise healthy a pill and drops out of a heart
and he's
attack.
going to have a heart attack.
Correct.
No.
So you always hear the warning on the commercial, and rightfully so. Please talk to your physician about whether or not it's safe to start this medicine and start sexual activity. Just like they always say, talk to your doctor about before you start any exercise routine. It's the same thing. You don't want to take some guy who's got terrible coronary artery disease and go to the gym and run him on the treadmill at, and a 10% incline at 5 miles an hour, right? So it's the same thought process. But in general, the pills are very safe. Side effects tend to be things that, again, would make sense for dilating blood vessels and stuff. So you dilate blood vessels in your eyes and it gets blurry. And we also have those same receptors in the back of our retina. So the blue vision people talk about is because of cross reactivity with different receptors in the eyes. You get facial flushing because, again, those blood vessels are sort of opening up. You can get a little bit dizzy. You got to be careful potentially with other high blood pressure pills.
Don't operate heavy machinery.
Yeah, all that stuff, right? And then Cialis has a unique one where it causes, in some cases, some back pain. So I'd say in general, in my experience, I think guys tolerate the Cialis a little bit more, but not always. So again, it's very personalized, and some people respond to one medicine, not the other.
Is there anyone you absolutely would not prescribe those medications to?
That's a great question. And it is absolutely a contraindication if someone is taking, the late term would be nitroglycerin for their heart or nitrates, because there's a theoretical concern of dropping blood pressure. Now, so that's the only medicine where I'm like, listen, if you've got that medicine and you take it on a regular basis, I can't prescribe this. If you're like, well, I have it there as a just in case, I haven't taken it in a year, I go talk to your cardiologist and then throw that pill bottle out. And if you're allowed to do that, I'll prescribe the medicine.
Okay.
Now, again, we've got a lot of guys who have high blood pressure and ED. I really don't get phone calls or hear of my patients going to the ER going, God, doc, you started me on that Cialis and I passed out. So it's relatively rare that people really do pass out from these medicines. But again, there's what we've got to say medical legally, what's in that packet and what they say in the commercial, and what's reality. My reality is that for overall, these things are pretty well tolerated. And probably the most common reason guys go, God, I take it, it works, but I get such an awful headache. I get flush. I just don't feel good, and then they stop it for that. Okay. But if you tolerate it, it's some of our happiest patients.
When the pills don't work and the shot doesn't work, they come to see you to talk about anything else?
Yeah, I mean, listen, I think they should come see me whenever you're thinking about needing the pills. I mean, I think ultimately, like I said, we could do everything from surgery to holistic measures to get this better. Mm-hmm. You don't get that personalized treatment when you just dial a doc on some commercial so they can discreetly send you your little Viagra packet, a little blue thing or black,
right,
little gum packet you put in your pocket, right? Yes, if you know you need it and you want to give it a try, great. If you can't get in with a urologist because they're jerks or they're booked out because of where you are, great. If you're in Nashville, come and see us. Come get an evaluation, get your testosterone levels checked. Let's do a good, wellness check on you. Let's make sure that you don't have blockages of your coronary arteries. Let me do a deep dive in your history and make sure I think the medicines are safe. Let's personalize that dosage for you. And then if you have issues, I'm there for you. It's not, people just, there's a pill for every ill in this country, right?
Right.
I've got a diagnosis. Give me the pill, leave me alone. Sure. And us doctors are to blame for that. That's how we treat a lot of patients. It's like, all right, what you got? Next, what you got? And it's just out the door, right? It's a volume-based game. How many prescriptions can I write as quickly as possible and get you out the door? That's not what I believe in. That's not what our practice believes in. So I want to leave everyone after this sort of 3-part series realizing that a comprehensive approach is the best approach. And there are people out there who do that. There are men's health clinics and other great urologists throughout the country who can be a great resource. We're not the only place who does this, but if you're in Middle Tennessee and want to come see people who know what they're doing with this and can really get to that root cause, this is why I trained for all these years. This is the nuance of it. But nonetheless, you still got to know some of the facts about the meds. And sometimes the pill may be all you need and they can work great.
Okay. This is a lot of good intel.
Yeah, absolutely. You want to send us on home here, Kat?
Yep. Let me wrap it up.
Just the tip.
Okay, to wrap it all up for today, erectile dysfunction medications are safe and well tolerated by most patients. Everything is always a most. Nothing is an all, 100%, by most patients. Number 2, medications do not treat the root cause, but they can improve the quality of life immediately. And the last thing, when pills don't work, an evaluation by a board-certified urologist can provide other options.
Yeah, I think it was a great summary. Yeah, I mean, I'm surprised it took us again this long to kind of do a deep dive into the penis and erections, but yeah, I think we were pretty thorough with this. I've only eaten twice today, and so we got to.
He's kind of losing it.
We got to wrap this up because the blood sugar is low for sure.
No blood is moving to your lower extremities.
Oh no, that's good. Yeah, that's clearly happening. I said the blood sugar.
Okay, just checking.
The blood flow down there is good.
There's that new Menendez documentary on Netflix, and that's where I'm going to be tonight. So
it looks like I'm getting a steak, a glass of wine, and I'm going to bed, folks.
Night. I'm just kidding. I'm kidding.
That great job with the podcast. I really appreciate having you on.
Yeah. Well, I'm here to help.
Yep, great.
Here to help.
Oh, dear Lord. See,
I'm not saying anything else. I'm not saying anything else. You wrap it up. You're
I'm
the
not gonna-
doctor. You're a medical professional.
Guys, listen, I'm not going to incriminate myself, but I think you can appreciate what I'm going through here. And this is exactly what I can help you with. At the very least, we can share war stories and commiserate. And for the couple times a week that there's not a good Netflix series on, we've got some hope. So
Wow.
So it'll be all good. So,
Wow. Good times.
Well, hey, listen, this was fun. In all seriousness, we hope we brought some awareness to ED. We hope you realize that there's options beyond the online pharmacies. In episode 1, again, we kind of went into the deep dive of what is ED and the root causes. Episode 2 here of this series, we covered the natural treatments that are available. And then we closed it on home here with some of the pills. And, ultimately here, we want to be your partner. Optimizing performance in the bedroom means getting to the root cause of these things. And that's really where I feel we can make the biggest impact. So please leave some comments here, subscribe, do all the things you're supposed to do to spread the word about the Balls Deep podcast. We have fun here and we want to keep doing this. So until next time, please show yourself a little bit more love and grace. We're all works in progress, and these are opportunities to grow, along with something else that can grow.
Oh, wow.
I mean,
I was waiting for it.
It was just
hanging in the air.
It was too good. It was too perfect. Thank you.
We're out.
We're out. See ya.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.